I will talk about something quite new which is entering our field, and this is AR VR glasses and hand-mounted displays in vitreoretinal surgery. There are already available medical devices. There is a rumor that HMD MD will be part of the new suite of size 850. Like a Provo 8X, they already introduced the MyVeo, and Bionics One was one of the first to introduce the head-mounted displays. What is bothering me is that I need to put something on my head, and while they try to make it lighter, it is somewhere between 300 to 600 grams per weight. So you can imagine that you need to wear this all day, and it might be a little bit uncomfortable. The other thing that I don't like is that the industry doesn't disclose the full specs of the devices, the resolution, the depth of field, the field of view, and things like that. They just say this is state-of-the-art device. So when I try to look what I can do, obviously I use ingenuity, and I need to have an initial setup, connectivity and adaptation. Different AR devices, they are connected by different ports, power supply, 3D mode compatibility, and spatial awareness. Because when you have something in front of you, you need to be connected with the rest of the surgery room and the environment. So what I did, I find available consumer devices which, based on their specs, might be suitable for surgery. So my personal experience starts in 2019. Then you see a lot of devices which I tested. There was a gap in between 2023 and 25 because the existing devices were not up to the task. So this was the first thing that I used, Avegan Glyph, which is a DLP retinal projection device with active HDMI connection, meaning that you need to power up the device. So it provided a good spatial awareness, but the resolution was not sufficient. Later on, I tried Goovis Pro, which is already with enough resolution, but what I didn't like is that it is heavy and it closes my field of view. Next was the Goovis G3 Max, which is actually with 5K resolution, so in theory it's pretty good, and in practice it was pretty good in terms of image quality. But since it is quite heavy, you can use it as a digital ocular, so kind of defeats the purpose of having something digital in front of you while you might use the regular oculars. So this is another thing to have in mind. Sometimes the digital device is not better than the analog one. And then in 2025, Rocket Max hit the market. So these are quite lightweight glasses, and frankly speaking, with disappointing quality of the image. So it is not my choice. It is doable, but the image quality is not good. And my personal choice is actually X-Real One Pro, which is again augmented reality glass set with proper resolution, proper image quality, and it is lightweight, and the connection is due to DisplayPort cable. So the ingenuity can be used with such glasses. But first, there is a comparison with the TV screen. What we need to know is that all the HMD devices are active 3D technology, and TV screens that we are using are passive technology. There are advantages and drawbacks, but the drawbacks in the active technology and the HMD devices from my point of view, is the pixelization. You see the pixels because they are quite close to your eyes. You see the digital noise. The latency is not the issue, but you might see like waxy movements, which relates also to a motion blur. Field of view depends from the settings, because some of the glasses might allow you to increase the field of view, which bring more magnification also. Depth of field is similar to the TV screen. You might experience visual fatigue because of the closing shutters between one and the other eye, and 3D crosstalk, meaning that you might perceive images from the left and right channel simultaneously. All that things are not seen in the screen, so up to now my preference still holds this TV screen. And while we might need HMD devices or AR glasses, first and foremost, for the temporal sitting surgeons, the logistics to move the screen for the left eyes and for the right eyes can be avoided when you have your glasses on. Of course, it is really useful for knowledge sharing via remote observation, remote mentoring sessions, and 3D surgical viewing videos, because nowadays we don't have 3D screens. And my choice, as I said, is X-Real 1 Pro. I don't like Rocket Max, and the Viture Woman Pro XR is not compatible with the Ingenuity, because it expects full side-by-side image compared to what Ingenuity exports, which is half side-by-side image. Thank you very much.